What if the reason you're exhausted, achy, and struggling to sleep has nothing to do with getting older, and everything to do with a single vitamin most doctors never think to test? I'm Dr. Lucas Bennett, board-certified physician with over 20 years in clinical practice. And today, I'm revealing the #1 deficiency, quietly affecting millions of Americans over 50. This isn't about exotic supplements or expensive treatments. This is about something your body desperately needs, something that most seniors are running dangerously low on right now. And the consequences of ignoring it are far more serious than most people realize. By the end of this video, you'll know exactly what it is, why you're likely deficient, and the simple steps you can take starting today. Stay with me, because this one could genuinely change how you feel every single day. Here's the reality. According to research published in nutritional science journals, more than 40% of American adults are deficient in this critical nutrient. But among adults over 60, that number climbs even higher. Some estimates suggest it may be closer to 70%. And the troubling part? Most people have no idea. The symptoms are easy to dismiss as just aging. The fatigue, the low mood, the muscle weakness, the brain fog. I see this pattern in my practice constantly. And every time I run a simple blood panel and show patients their numbers, the reaction is always the same: disbelief. You deserve to know what's happening in your own body. So let's get into it. Number 5, the vitamin that controls more than 200 bodily functions. The nutrient I'm talking about is vitamin D, often called the sunshine vitamin. And I want you to understand from the very beginning, this is not just a bone health supplement. Vitamin D functions more like a hormone in your body than a traditional vitamin. It regulates your immune system, your mood, your cardiovascular health, your muscle strength, your sleep quality, and yes, your bone density. But that's just the beginning. Think of vitamin D as the master key that unlocks hundreds of biological processes. Without enough of it, those processes start to slow down, malfunction, or stop working altogether. And here's the critical part. Your body can't make vitamin D from food alone. The primary source is sunlight hitting your skin and triggering a conversion process. But as we age, that conversion becomes dramatically less efficient. A 70-year-old produces up to 75% less vitamin D from the same sun exposure as a 25-year-old. Add to that the fact that most seniors spend more time indoors, live in northern climates, or wear sunscreen, and you have a recipe for widespread chronic deficiency. Here's what you need to do with this information. Don't assume that because you go outside sometimes, your levels are fine. They may not be. Talk to your physician about getting a 25-hydroxyvitamin D blood test. It's simple, it's inexpensive, and the results will tell you exactly where you stand. Knowledge is the first step. Number 4. What deficiency actually feels like, and why it's so easy to miss. Let me tell you about Margaret, a 68-year-old retired school teacher who came to see me about 2 years ago. She was tired all the time, not just sleepy, but deeply fatigued in a way that sleep didn't fix. She had aches in her bones and muscles that she assumed were arthritis. She'd been feeling low, almost mildly depressed, for months. She'd brought this up to her previous doctor, who told her it was a normal part of aging and suggested she try to exercise more. When I ran a comprehensive panel on Margaret, her vitamin D level came back at 14 nanograms per milliliter. The generally accepted optimal range for adults is between 40 and 60. She was critically low. In my clinical experience, I can tell you that below 20 is where we start to see serious systemic effects. And Margaret had been living there for likely years without anyone checking. This is the insidious thing about vitamin D deficiency. Its symptoms mirror almost everything we've been told to expect as we get older: fatigue, muscle weakness, joint and bone pain, low mood or mild depression, difficulty concentrating, poor sleep, frequent colds and infections. Sound familiar? These are the symptoms millions of seniors are living with every day, chalking up to age, when in reality, the body is simply starving for a nutrient it cannot function without. Pay close attention if you regularly experience any combination of those symptoms, especially if they've crept up gradually over months or years. That pattern is highly characteristic of deficiency, and it's worth investigating. Before I continue, if you're finding this valuable, hit subscribe right now. I share critical health information every week specifically for adults over 50, and next week's topic is just as important. Don't miss it. Number 3. The hidden dangers. What low vitamin D does to your heart and brain. Now this is where things get serious, and I want you to pay close attention. Research over the past decade has revealed connections between vitamin D deficiency and HON, conditions that go far beyond fatigue and bone loss. We're talking about cardiovascular disease, cognitive decline, and immune dysfunction. Studies published in major cardiology journals suggest that low vitamin D levels may be associated with a significantly increased risk of heart disease, high blood pressure, and stroke. Here's why. Vitamin D plays a role in regulating inflammation throughout the body, and chronic inflammation is one of the primary drivers of arterial damage and plaque buildup. Think of it like this. Without adequate vitamin D, the inflammatory fires in your arteries can burn hotter and longer, quietly damaging your cardiovascular system over time. The brain connection is equally concerning. Research suggests that seniors with lower vitamin D levels may experience faster cognitive decline and have a higher risk of developing dementia. Scientists believe this may be related to vitamin D's role in reducing neuroinflammation and supporting the health of brain cells. I had another patient, a 72-year-old retired engineer named Harold, who came to me concerned about his memory. He was having trouble finding words, forgetting appointments, feeling mentally slow. His vitamin D level was 11. After working with his doctor to bring his levels into a healthy range over 6 months, Harold reported a noticeable improvement in his mental clarity. I want to be clear. We cannot claim vitamin D cures cognitive decline, and Harold's improvement may have involved other factors, but the correlation was striking, and it aligns with what the research suggests. If that surprised you, wait until you hear what's coming in number 2. Number 2. Why seniors are uniquely vulnerable. The absorption problem. Nobody talks about here's something critically important that most people don't know. Even if you're eating foods that contain vitamin D or taking a supplement, your aging body may not be absorbing it properly. And this is the key reason seniors are so much more deficient than younger adults. The absorption of vitamin D depends on fat because it's a fat-soluble vitamin. This means it needs to be consumed with a meal that contains some healthy fat in order for your intestines to absorb it effectively. Many seniors are eating lower-fat diets, which can inadvertently reduce absorption. Additionally, certain very common medications taken by millions of adults over 60, including some cholesterol medications, weight loss drugs, and even certain blood pressure medications, can interfere with vitamin D absorption or metabolism. Research also indicates that people with darker skin tones produce less vitamin D from sunlight and may need to be especially vigilant about their levels. There's also the kidney connection. Your kidneys play a critical role in converting vitamin D into its active, usable form. As kidney function naturally declines with age, this conversion process becomes less efficient. So even if you're getting reasonable sun exposure or taking a supplement, your kidneys may not be doing their part of the job as effectively as they once did. Here's what you need to do. When you speak with your doctor about testing your levels, also ask them to review your current medications for any known interactions with vitamin D metabolism. And if you do start supplementing, always take it with a meal that contains some healthy fat, olive oil, avocado, nuts, or fatty fish to maximize absorption. Thousands of adults over 50 are relying on this channel for honest, science-based health guidance. If you haven't subscribed yet, do it now and turn on notifications. The information in these videos could genuinely make a difference in your health. Number 1, the most critical consequence, and what you can do about it right now. This is the one I want you to remember most because it's the most urgent and the most actionable. Vitamin D deficiency is a leading contributor to osteoporosis and fall-related Fractures and falls are one of the leading causes of disability and death in adults over 65. This is not a small issue. The CDC estimates that 1 in 4 Americans over 65 falls each year, and fall-related injuries account for billions of dollars in medical costs, and more importantly, tremendous loss of independence and quality of life. Here's the mechanism. Vitamin D is essential for calcium absorption in your gut. Without enough vitamin D, your body cannot properly absorb the calcium you're eating, no matter how much dairy or calcium supplement you consume. And when your blood calcium drops too low, your body does something alarming. It starts pulling calcium out of your bones to maintain blood levels. Over time, this leads to bones that are hollow, fragile, and at serious risk of fracturing. But there's more. Vitamin D is directly involved in muscle function. Low levels are associated with significant muscle weakness, particularly in the lower body. Weak leg muscles combined with brittle bones is a dangerous combination. It increases both the risk of falling and the severity of injury when a fall does occur. I had a patient, a 74-year-old grandmother named Dorothy, who fractured her hip stepping off a curb. Before that fall, she had been relatively independent, driving herself to her grandchildren's school events, working in her garden. After the hip fracture, she spent 3 months in rehabilitation. She never fully regained her prior level of independence. When we reviewed her records, her vitamin D had never been tested in over a decade of primary care visits. That story breaks my heart, and the reason I tell it is not to frighten you, but because Dorothy's situation was preventable. A simple blood test, appropriate supplementation under medical guidance, consistent follow-up, that's all it would have taken. Here's what the research tells us about vitamin D supplementation in seniors. Studies suggest it may help reduce fall risk, support muscle strength, improve bone density, and could reduce the risk of fracture. The evidence is not perfect. No evidence in medicine ever is. But it is consistently strong enough that most major health organizations recommend screening and supplementation for adults over 60, especially those who spend limited time outdoors. Do me a favor. If someone you care about is over 60, share this video with them and subscribe so they never miss health information like this. It could protect their independence. Now, before I close, let me bring all of this together for you. Today, we covered 5 critical things you need to know about vitamin D. First, that it controls over 200 biological functions in your body, and that aging dramatically reduces your ability to produce it from sunlight. Second, that deficiency often feels exactly like normal aging, fatigue, muscle pain, low mood, brain fog, making it easy to miss. Third, that low vitamin D is associated with increased risks of heart disease and cognitive decline. Fourth, that seniors face unique absorption challenges that make deficiency even more likely, even with supplementation. And fifth, that vitamin D deficiency is a critical driver of bone loss, muscle weakness, and fall risk, one of the most dangerous threats to your independence as you age. The key takeaway is this: you have the power to know your numbers and take action. This is not complicated. This is not expensive. It starts with one conversation with your doctor. Here's what I want you to do in the next 24 hours. First, call your doctor's office today and ask to have your 25-hydroxyvitamin D level checked at your next blood draw. Write it down so you don't forget. Second, take a look at your current medications and bring a full list to your appointment. Ask your physician whether any of them may affect your vitamin D levels or absorption. Third, if you're currently taking a vitamin D supplement, make sure you're taking it with a meal that contains some healthy fat. If you're not taking one, don't start without first consulting your physician to determine the appropriate amount for your specific health situation. Remember, this information is for educational purposes only, and you should always consult your physician before making any changes to your health routine. Every person's situation is different, and what's right for your neighbor may not be right for you. Your health is in your hands, and the fact that you're here watching this, asking these questions, that already puts you ahead. Don't let what you've learned today stay theoretical. Take one step, Make one call. Your future self will be grateful. Tell me in the comments, what surprised you most about vitamin D today? Have you ever had your levels tested? I read every single comment, and your experience may help someone else watching this video. I'm Dr. Lucas Bennett. Take care of your health, and I'll see you in the next video.